Hi there, it's Mark McDonald from apneatreatmentcenter.com. In this quick video, I'm going to answer the question, what is sleep apnea? And I'll provide you with an overview of this common but little known health condition. So let's get started. But first, a little bit about me. First of all, my wife and father have obstructive sleep apnea, and I started researching apnea treatments in 2008. It was actually my wife's symptoms during the night that prompted me to look further into sleep apnea. She would wake up gagging during her sleep, and I went online to Google and I started Googling her symptoms, and I found out that she had obstructive sleep apnea. Since I started researching apnea treatments in 2008, I've uncovered dozens of treatments, and a lot of these treatments family doctors don't even know about. And I think the reason they don't know about them is because family doctors are very busy, and sleep apnea is only one of many conditions they have to deal with in their practice, and they simply don't have the time to keep up with these new treatments. And my focus has been on treatments that don't involve CPAP, because CPAP is not appropriate for my wife. She gets claustrophobia, and she simply can't handle it. So I know a lot of other people can't handle it as well. So I've been focusing on treatments that don't involve using the CPAP equipment. And if you want to learn more, you can go to my website, which is www.apneatreatmentcenter.com. So what is sleep apnea? What's the definition of the condition? Well, the word apnea comes from a Greek word, apnea, which means breathless or a cessation of breath. So basically, sleep apnea is the repeated involuntary stoppage of breathing during sleep, which is caused by a narrow airway or a blockage in your airway. So the bottom line with sleep apnea is that when you're fast asleep, your airway closes and you temporarily stop breathing, which means oxygen stops going into your body, which is extremely bad for your long-term health. So how does the airway get blocked? Well, during your sleep, your throat muscles relax and the airway collapses, which blocks the airflow to the lungs. So what happens is, in cases where people are either overweight or obese, or with elderly people, their airway is either blocked because of excess tissue or fat in their upper airway, or the muscles in their upper airway are very weak, which causes their upper airway to collapse during sleep. That's the main way that obstructive sleep apnea is caused. Other ways include blockages in the nasal passage by things called deviated septums, deviated nasal septum, and other blockages in the nasal passage. But the main way is a blockage in the upper airway caused by either excess fatty tissue or weak muscles in the throat. So during breathing pauses, the body experiences extreme distress. Obviously, when you stop breathing and your brain realizes you're not getting oxygen into your system, you start to panic, or at least the body goes into panic mode. The brain fails to relay the proper signals to the breathing muscles, and in severe cases can cause death. So what are the short-term effects of sleep apnea? Well, there's quite a few actually. They include daytime sleepiness, poor concentration, increased risk of road accidents because you're not able to pay attention as well and you're sleepy, daytime lethargy or fatigue, a loss of interest in sexual activity, lack of daytime alertness, anxiety and depression, and many other short-term effects. So if you're experiencing any of these things, it's quite possible that you have sleep apnea. Now, what about snoring and sleep apnea? Well, snoring is a very common sleep disorder that is often related to sleep apnea. However, not all snorers suffer from sleep apnea, so it's important to realize that just because you snore doesn't mean that you have sleep apnea. If you snore, ask yourself these questions. Do you snore loud and persistently? Do you gasp or choke during your sleep? Do you wake up with a headache? Do you feel lethargic or tired on waking up? Do you have problems remembering or concentrating? So if you answered yes to any of these questions, you should have yourself checked by a sleep doctor or start with your family doctor. Some sleep apnea statistics for you. Sleep apnea affects 18 million American adults, and that's just an estimate because it's also estimated that about 90% of people who currently have sleep apnea don't even know it, and that's often people who are overweight or obese. The vast majority of people who are obese have sleep apnea, and a lot of them don't know it. About 1 to 10% of children between 2 to 10 years old suffer from this condition too. So what are the risk factors for having sleep apnea? Well, as I've mentioned a couple of times, being overweight is probably the number one risk factor. If you're overweight, and especially if you're obese, the chance of you having sleep apnea are dramatically increased. Second, males tend to have it more than females. Also, if you have a family history of sleep apnea, that could be a risk factor. If you're 65 years or above, that's also a risk factor, and that's because, as I mentioned, as you get older, the muscles in your throat tend to become weaker and less toned. And when the muscles in your upper airway are weak, then your upper airway collapses when you fall asleep, and that's when the apnea takes place. Also, if you smoke or if you consume excess amounts of alcohol, that's also a risk for having sleep apnea or worse sleep apnea. And that's because, again, when you fall asleep, these things tend to relax your muscles, and that causes the apnea. So how about the physical characteristics that contribute to the risk? Well, a thicker neck circumference can indicate that a person has sleep apnea. A deviated septum, and the septum is that wall in between your two nostrils in your nose. A deviation of that means that it's crooked, so one nostril is smaller than the other. A receding chin, or enlarged tonsils or adenoids. And so all these things basically mean that the upper airway is too small or is collapsing while you sleep, and that's what causes the apnea. So what are the suggested lifestyle changes? Well, the number one thing is to lose weight, because if you lose weight, you'll have less fatty tissue in your upper airway, in your throat, and that means that you won't have a blockage or as much of a blockage. Also, you should say no to smoking. You should avoid sedatives, alcohol, and sleeping pills before bedtime, because those things all help you to relax even more. Now, relaxation is good, of course, when you want to fall asleep, but if it causes your throat to be blocked, then it's not good, obviously. Keep a regular sleep schedule, and don't have any caffeine or heavy meals 2 hours before bedtime. Early diagnosis of sleep apnea is the key to faster recovery. When treatment is initiated, significant improvement is observed in the quality of sleep and overall quality of life. So if you have any of the conditions or symptoms that are mentioned in this video, you should check with your family doctor immediately. Now, if you need more info, please do visit my website. It's www.apneatreatmentcenter.com. Now, in my biased opinion, I guess, it's the best website on the internet for sleep apnea treatments. I have a lot of information on there, not only on treatments that most people have never heard of, but also on diagnosis, on side effects, on related conditions. I've spent hundreds of hours on the website, and again, in my opinion, it is the best resource on the internet for sleep apnea treatment information. So as I said, there's easy ways to get diagnosed on the website, cutting-edge sleep apnea treatments that most family doctors don't even know about, related conditions, and a lot more. There's tons of information on there. So please do visit apneatreatmentcenter.com, and I hope you enjoyed this video.